Hello everyone. Um, so I know I did a little update a couple days after I had my procedure on January 31st to remove my bladder. As I had stated in that video, if you missed it, if you didn't get to see it, I went in for my procedure in the morning, January 31st. I was very calm. I was ready to have my procedure done and have this kind of behind me. Um, Went in with a very positive attitude. My boys, they both came with me. And, I felt pretty calm considering what I was about to undergo, which was an 8 hour, anticipated to be 7 to 8 hour procedure to remove my bladder. So, story time, I guess, as to what happened, what transcribed, the reason why I still to this day, February 7th, have my bladder in place. I was prepped, for surgery to occur at about 7:45. Rolled into the OR room, and if anyone's had surgery in the past, when they roll you into the OR room, the anesthesiologist is in there. You have a bunch of other staff, nurses that are part of the OR team, and basically shortly thereafter, you go night night until they wake you back up for your recovery period to start. So when I rolled in at about 7:45, I was then woken up at around 10:30 because I looked at a time when, as I was coming out of anesthesia, and the nurses were talking to me and asking me how am I feeling, are you fully awake? And I just happened to, feel down on my stomach because I know that's where my bag should have been, and nothing was there. And I then looked back at the time that was on the wall behind me. Of course, I'm like freaking out at this point because I know something is not right. I knew that the procedure was supposed to be a certain amount of time, and for me to go in at 8 o'clock and then be woken up at 10:30 didn't make sense. So obviously something went wrong. So my doctor ended up coming in per my request, even though I was still kind of, foggy because I'm just coming out of anesthesia and the medicine they give you to put you to sleep. And she basically tells me that I had a cardiac event. Well, the nurses told me that prior to her coming in. Let me just make that clear. And that's kind of what set my panic mode into even more panic mode. And I demanded to see my doctor right away. And she confirmed that during the procedure, early into the procedure, they barely started anything. Like I said, it's supposed to be an 8 hour surgery. So that just, shows you how in depth the surgery would have been. We were only maybe an hour into the surgery, if that long. I'm still waiting for the complete report on that before they had to abort the surgery. So what happened was, and I'll just explain it as I understand it in somewhat layman terms. So the type of surgery I was supposed to have was going to be done robotically. So instead of, them making a huge cut in your stomach and opening you up, which usually there's a longer recovery period. They were going to do it now, with new technology. They can pretty much do a lot of surgeries using the robots. They poke little holes in your belly, in your abdomen, depending on where, they're going to be working on. So I've had this type of surgery before. As I've stated before, I had my right kidney removed back in 2021, and that surgery was done by another doctor who specializes in kidneys, excuse me, and he removed my right kidney using the same type of surgery procedure, which is using the robot um, to do the surgery. So I've had several other surgeries that have been done where I've gone under anesthesia, and I've never had any complications with any of those procedures. So how it was explained to me was that when the anesthesiologist put me to sleep, they also, they had to inject prior to me going to sleep. They also had to inject medicine into my stomach area to relax those muscles so that when I woke up 6-7 hours later after the surgery, due to the surgery that was done and the holes that they put in your stomach, it would then it will then produce medicine to numb my stomach, basically. So it would help with the pain after I was awoken from the surgery. And then, they give you other medications through the IV to put you to sleep and, to help you with being sedated so that you don't have any failing. So that took place. The anesthesiologist did what they were supposed to do. And when my doctor went to put in the gas into my stomach, so they inject your stomach with this type of gas solution, and that expands your stomach. So it basically stretches your stomach so that it's almost like a balloon, so that the organs inside of your stomach can be more visually seen by the doctor that's performing the surgery. So this is typical standard protocol for any laparoscopic surgery using the robot. They have to put this gas in to expand it. So when she put the gas in my stomach, apparently it compressed on a nerve that we have in our body. I won't get too technical. And because the gas was either too much at that time, the pressure was too much, it caused it to compress on that nerve, and basically I passed out. So my heart stopped. So they said that I was my heart was not beating for, I believe, up to 13, let's say 15 seconds. That's what was told to my son after, the event happened. They always have to let someone know, if something goes wrong or, goes right. So he was the first one to be notified after this took place. And, just needless to say, anytime you hear your heart stopped. So first I'll back up, and I fully understand that with every surgery, especially a major surgery like this, you run the risk of things possibly not going the way they're supposed to go. You run the risk of death. Every surgery, pretty much, you run the risk of possibly dying. Not a risk that was high in my with my surgery. The surgery's been done many times by many doctors on many patients. And like I've said before, most of the patients that have this type of surgery are older individuals. I'm only 42 years old, um, pretty healthy for the most part. As far as comorbidities goes, I don't have high blood pressure. That's something they always, check for, because that can throw off your vitals when you undergo any kind of major surgery. If you have high blood pressure, they have to make sure going in prior that it's pretty well managed. I went in with a very good blood pressure reading, heart rate reading. All my readings were fine. I've had cardiac workup done prior, and prior to other surgeries, and never had any cardiac issues. My blood work was done. Everything was done to ensure that I was at my uh, optimal level, I guess, of being able to tolerate this type of major surgery. They definitely would not do a surgery on someone that, you know, had medical issues that could potentially be life threatening. They would probably consider a different way of doing the surgery, or make sure I was on certain medications whatsoever. Anyway, so I say that to say that a lot of times people hear, "Oh my goodness, they had a cardiac event." Well, maybe they had a history of cardiac issues, or they developed it and didn't know it. Um, I don't. I had tests done afterwards, EKG, if you know what that is. An echocardiogram was done of my heart, to make sure the vessels and everything surrounding it and the heart itself is functioning and working at its capacity. And it is. Everything checked out, um, that I have a healthy heart, which I know I did. I might be a little bit overweight for my height and age, but I do work out. I do my cardio, and I really do that. I'm not really, anyway. I'm not even gonna go too much in depth with that, but I try to be active as much as I can, so that I can be you know somewhat fit to be able to do the things that I need to do. So, needless to say, I was very shocked, very disappointed um, at the events that had occurred. Um, and I am still shocked. I mean, anytime you hear that your heart stopped, it's like, thank God I'm still here, because my boys, they are my reason, and I can't imagine not being here um, at this point in time. And we know, if things happen, and life and death is not on our time, but certain events can be um, avoided, I guess, or prevented, I should say. And I feel like this event could have been. And I don't want to go too much into, those who don't know, I don't really want to go too much into why I believe that. Let's just say that, when you're having um, any kind of chronic issues, or any issues with your health, just make sure that you do your research. And it's crazy for me to say, because I am in the health field, and I really truly try to do my research, so that I know what I'm getting into, um, and I know who will be caring for me, um, as far as my physicians, my doctors. Um, So, you know, just a word of advice, from, I feel like I had to learn this lesson the hard way. Um, just make sure that when you're um, when you're going through something, that you have a medical team that is knowledgeable, that is open and honest about their expertise in that area. Um, and doctors have to start somewhere. So I'm a therapist. I had to start from the ground up. And many times when I was starting out 18 years ago, people would say, "Oh, I walk into the patient's room. Oh, you're so young. How could you be my therapist? You could be my daughter." Da, 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 da. And I still get that sometimes. I guess I have a baby face. I don't know. But yeah, young doctors are great. And that, I don't want to say I chose, but this doctor was chosen for me. And I respected her expertise in this field, although she didn't have a lot of I guess surgeries under her belt. So needless to say, things went wrong for whatever reason. Could have been divine intervention. And I am a believer in that God, he puts us in, he helps us through certain situations that we sometimes don't know why we're placed in that situation, and why the outcome of that situation is the outcome that it was. And I feel like this circumstance was definitely intervened or not completed because when I think how I'm trying to explain, it was not done for a reason. Let's just say that, because I'm blessed that I am still here. I'm still here to talk to you guys. I'm still here to tell you that God is good, and that I'm amongst the living. We can't take that for granted, and I never took it for granted, and this is definitely, even more. I don't take a day for granted, because we see how the world is. Anyway, so yes, so that happened. Like I said, all my tests afterwards, I stayed in the hospital for a day, came back good. All my numbers were good. So they let me go home the next day. So now what is going to happen? I am now left with having to make the decision of going with another doctor at more than likely another hospital, possibly locally to my home, possibly not. We don't really have any major cancer centers where I live, upstate New York. So most people are familiar with New York City. Being a bigger city, they do have a major cancer center there, Sloan Kettering. And my neighboring city, Boston, they also have another center there, Dana-Farber. So I did end up going back to my old urologist, who has been following me for, the first 4 years of this battle, before I decided to have the bladder removed. He does not do bladder removal surgery, so that's why I was sent to this other office that had a doctor that did this type of surgery. Excuse me. So I've made a decision that I don't feel comfortable going back to that office, and he did suggest or give me some suggestions on what he would recommend for me going forward. And as I stated, that would be going to see another specialist that does this type of surgery and seeing if he would be able to. And obviously, I am going to be um, more proactive in researching and making sure that I make the right decision on who's going to be doing this procedure going forward. This is not something that should be taken lightly by any stretches of the imagination. This is my life, so I'm a huge advocate for asking the tough questions, and when it comes to my doctors, and really ensuring that you get proper care and proper treatment. And I feel like unfortunate events that occurred that did not happen, even though I did trust my doctor um, prior to going in for surgery. Um, yeah, that's unfortunately changed now. So I'm impressed with the unfortunate decision to have to find a new surgeon to do my surgery. Not only just find a new surgeon, but make sure it's the right surgeon for me, and also um, I would rather have it done sooner rather than later, due to me having to have taken so much time to get prepared for this surgery, mentally, physically, financially, with the mindset that I would be out of work for 3 months. So I'm left now with will the next surgeon be able to, read up on my case and do whatever tests that needs to be done before he can make the decision on whether or not he can take me on. And then if he takes me on, how soon can he get me into the OR to have the surgery done? Yes, I would much rather have it done sooner rather than later, but I, you know, I have to work on the surgeon's time. I have to work on God's time, and that might not be my time. So, yeah, I guess stay tuned for what will be taking place next. It's still kind of up in the air what the next step will be, whether I will have my surgery within the next couple of weeks, if I'm going to have to wait a couple of months, I'm going to have to undergo some more testing before a decision is made, if I'm going to have to go out of state. I don't know. So it's a lot to process, a lot to deal with, especially when, it was, I thought everything was planned out to the T. But things don't always go as planned. Um, was I depressed? Was I sad? Was I angry? All the above. Am I still? No. I think I've moved past that phase. Thank you to my great, amazing support team and my prayer warriors out there. You guys have been amazing, um, calling to check on me, um, all the calls, texts, messages, cards, you name it. It it was really felt, and still is felt. So I just wanted to kind of, this is a little long, maybe I'll edit it, just to kind of let everyone know what's going on. So everyone stay blessed, stay encouraged, and look out for the next one.